Hey guys, so today we're going to talk about mold exposure and treatment options in Chinese medicine. We'll talk a little bit about what exactly is mold, does it really cause significant health problems, and what do I do in my clinic when we have patients who come in for mold exposure. So, as always, I'm your host, Dr. David Cherian. I'm a board certified MD practicing medicine in the state of Texas and also a licensed acupuncturist. And my expertise is really on that nexus of between Eastern and Western medicine. How can we use both of these medical philosophical systems to really get the best results for our patients? And at our clinic, we take an integrative approach. It's really patient centered, and we do a lot of chronic illnesses all across the spectrum. We also do a lot of environmental medicine, and today's topic on mold really touches on the environmental aspect. In Eastern medicine, environments influence people and they shape our health in a big way. And it's something we tend to downplay in Western medicine, but it is really emphasized in Eastern medicine. And what I'm going to do today is really just help build a framework to think about mold exposure, your home environment, and reasonable steps to take if you might be in that situation. And we'll close with just my clinical approach to treating patients with mold exposure. So, the first thing, let's just start off with the basics, and that is what is mold? And to put it quite simply, mold is a fungal organism. It's a fungi that reproduces by releasing spores into the air. And if you think way back to your high school biology class, you learned about the different kingdoms in biology, right? So there's the animal kingdom, there's the plant kingdom, there's the bacteria kingdom, and there's the kingdom of the fungi. And mold belongs to the fungi kingdom. And mold really thrives in an environment where there are three key conditions. Number one, moisture. Number two, organic material that they can eat and ingest and grow from. And then number three, poor ventilation. So let's start off with the first one, moisture. And in Houston, moisture is a big problem. Houston is a humid city. There's so much humidity here, dampness here. It's a city that's built on the bayous. It's a lot of swamp type environment. And we have consistently high humidity levels here. Now, if you're in other parts of the country, you might have other sources of humidity like basements. Basements tend to trap moisture and humidity. You might just naturally live in a more humid place. We don't have basements in Houston per se, but here it's really just the natural environmental humidity. And we also have a lot of flooding. Flooding is a big driver for mold infestations as well. So we in Houston, we see a lot of mold cases. We have a lot of mold exposure in our clinic, and that's something that's common here. Now, the second thing that mold really needs is organic material. So that's things like your drywall, your carpet, your wood, insulation. When those combine with dampness, with moisture, that becomes just a readily available source of food for the fungi. And then the last thing that you really need is just stagnant air. So when there's stagnant air, when there's poor ventilation, that encourages mold growth as well. So that could be from a lack of air conditioning or no exhaust fans, especially in places that might have higher humidity like bathrooms or kitchen. There's not a lot of natural ventilation in those places, so the air can stagnate and that contributes to mold growth. Now, there's a couple common ways people recognize that they may have a mold problem in the home. The first way is by visually just seeing it. You might see black patches or green or white patches on the walls. You might see patches on the drywall or the furniture. You might smell a kind of musty smell in the house or in that area where mold's growing. And that's one of the common ways people just tell that there's mold in the house. The second way, and this is probably more common but harder to pinpoint, is when you feel symptoms of mold exposure. And the hard part about that is that it could really be a wide variety of symptoms. If you just get on the internet and look, the typical classic symptoms attributed to mold exposure are coughing, wheezing, sinus congestion. But the reality is that we probably don't fully know the entire spectrum of symptoms that mold exposure can cause. In my clinic, we have patients come in with all kinds of problems that are attributed to mold. Everything from just mental fog extreme fatigue, muscle aches. In fact, it's very few patients that just come in with the classic congestion, headache, coughing. It's very few people that come in with just those classic things you see on the internet. But the way we know it's probably related to mold is that in general, we see that the patients get better when they leave their environment. So the patients might notice that when they leave their house for a week to travel, go on vacation, or stay with a friend, family or friend, that they just start feeling better. And or maybe they used to be in good health and then they moved to this new apartment or a new house and they noticed that their health just started deteriorating. There was a clear connection to that change. And or they may notice that when they moved out of a certain place that their health just started to improve. There's usually just some clear connection between the environment and the health that the person has, and that's a lot of times how we make the connection. A lot of times the patients recognize this. They will come in and tell me that they noticed the connection between this place that they were living and when their symptoms began, and they're usually the ones who are able to make that connection. Now, the question is, does it necessarily have to be mold that caused it? Could it be something else in the environment related to that house or the place they're living? It could be, and it's possible. Now, from my standpoint, in terms of Eastern medicine and what my treatment approach is, it is less important. From a Western standpoint, when you're trying to find a specific pathogen, a specific organism, and give a specific antifungal medicine, yes, that can make more of a difference. But in the Eastern perspective, when we use our medical analysis, when I'm looking at a patient's tongue, pulse, checking their history, those are the main things that are going to drive our decision-making process, and less whether it's actually a mold and less what type of organism it might be. Now, it's helpful to know, but we're really going to base it on the tongue, the pulse, your history. And one of the things that we're trying to do is just build your own immune system. And one of the things that we notice is that when patients start our treatment, when they start having their immune system built up, they naturally just are able to handle mold exposure better. They're able to get better, even staying in the same environment that they were. Let's talk about a few of the specific mold. There's a specific mold called Cladosporium. There's another one called Alternaria. And then there are some more pathogenic mold like Aspergillus. There's Stachyboitris chartarum. That's a common one that's known as black mold. And that one can even cause neurologic symptoms and fatigue. And those are some of the ones that are recognized in the Western medical system. But again, from Eastern medicine, we're really cautious about drawing hard lines between what's dangerous and what's not based just on the organism. I think just from my own experience, it's possible that there are more symptoms than we're really recognizing in the Western system. And the most important thing is whether you've noticed an association between your environment and the development of the health issues, is that what's most important is that we're able to properly identify you in Eastern medicine using your tongue, pulse signs, and the history. So I want to talk a little bit about, in Western medicine, mold exposure is, like I said, primarily limited to causing symptoms like sneezing, coughing, red eyes, nasal congestion, and in more serious cases, it can cause wheezing or shortness of breath. It can also trigger asthma exacerbations or something called hypersensitivity pneumonitis, which is a kind of like a pneumonia, but it's still a limited set of conditions that we recognize in Western medicine. And I think one of the reasons for that is that a lot of times in Western medicine, we just don't take a thorough history to identify all the various symptoms that patients are feeling. And a lot of times patients themselves don't recognize the way they feel or the symptoms they've had, that it might be connected to an exposure in their environment. So a lot of times in the history taking, these details are missed. But the amount of symptoms that I've seen just from my clinical exposure with experience with mold exposure it's myriad. There's so many different things. And like I said, over the years, I've seen everything from extreme fatigue, GI symptoms, cramping pain, blurry vision, nerve pain, nerve disorders, chronic diarrhea, joint disorders, even just flare-ups of chronic conditions could be related to mold exposure. And what we see that when the patient either one leaves the environment or number two goes through our treatment process, a lot of these symptoms start to get better. A lot of things will start to resolve. So for a lot of these symptoms that we see, the most important connection is that environmental connection. Again, that means if you're in a specific environment like your home and you frequently get these symptoms, and then you're away from the home for a few days or a week and you know that things get better, that's a really important clue. That's a key connection point that we can connect the environmental link to your symptoms, and that makes a big impression on whether it's caused by a potential mold or environment. Now, this really brings up a common question. If there is an environmental problem, like if you do have mold in your house or something in your home that's triggering your health, what do you do? Now, it would be really nice if everyone could just pick up their bags and move to a new location or move to a new house, but that's not feasible for everyone. And not only that, sometimes it's unclear whether it's an environmental problem or not. So, first of all, moving may not be an option for you. You may not be able to just break your lease. You may be connected to a job that requires you to be in a particular location. You may not be able to afford to move. And additionally, like I said, it's just not always clear exactly what the environmental condition is. So for me, just personally, there were segments of my life when I lived in a house and in an apartment where my health was worse during that time. And I knew there was some kind of connection between where I was living. It clearly started after I moved there, but I couldn't pinpoint exactly what it was. But I also noticed that over time, doing Chinese medicine and herbal medicine, that my health improved. And I was able to tolerate some of those environments better than when I had, before I had started taking Chinese medicine. The other thing is you may have lived in one place your whole life and never noticed what it's like to be in a different environment or noticed any clear change in your body. So for a lot of different reasons, it's hard to be 100% sure whether it's something in the environment or a mold exposure in a particular house that might be causing your symptoms. Now, there's a whole specialty about home testing for mold and testing for environmental exposures, and that's really outside the scope of what I do. I do have patients who have gone down that route. I think the benefits of doing it, it's hard for me to understand. At some point, I'd probably like to bring on a specialist onto the show to give us a little more concrete advice in that area, but that's really outside of my scope. And the third comment I want to make about mold being in your particular home and the relative importance of testing and identifying it is, the question is, even if you were to find out that your home had mold and you moved out, the question remains, is the new place you're going to move to going to have that same problem? Right? So maybe you want to go to a new place, but how do you know the new place that you're going to doesn't have mold? If, like I said, if you live in Houston, so many homes already have mold. You might move to a new place that has the same problem, and you won't know until you already purchased the home or you signed the rental agreement and you're locked in. And sometimes the only way you're going to find out is by having the symptoms start back again after exposure. And that exposure, it might take time. It might not be instantaneous. You might take several weeks to develop that exposure, or months. So a lot of homes, like especially in the Houston area, there's been a lot of flooding, a lot of humidity. A lot of the homes do have some level of mold, and necessarily moving out from your current house might not fix the problem if the new place you're going to also has that same problem as well. And it's really difficult to know until you're actually there for some time. So when I talk to patients who have mold exposure about the risk they're facing, and then it comes time to discuss whether it's worth it for them to move out of their homes they live, it's a very nuanced conversation. It's very individually specific. We don't ever give a one-size-fits-all kind of blanket approach. Some practical guidelines, I usually tell people, if you have severe symptoms, like severe pain, severe fatigue, I mean, we have patients who can't work anymore because of their symptoms. If you're in a case where your symptoms are just so severe and you have a means by which you can temporarily leave, temporarily stay somewhere else, at least just do a trial to see if that might be it, then I would go for it. If you have a family member you can stay with and just see during that time if your symptoms get better, or if you're able to just go out of town for a few weeks and see if your symptoms improve, that's one way to know whether leaving the environment is going to be a significant benefit for you, whether it's going to be big enough of a benefit to go through that trouble. Now, just one caveat, sometimes once you've developed symptoms from mold exposure, it might not go away just by leaving the environment. You might continue to have those symptoms persist even after you left. So going away or leaving the environment doesn't necessarily mean you're going to get better without doing anything else. But it may be a necessary step for you to get better if it's feasible, if it makes sense. Now, we have a lot of situations in our clinic also where the patient's symptoms are relatively milder, they're more tolerable, they're more manageable, or there's just more uncertainty about whether it really is a case of mold exposure, whether there is really something in the environment going on. It can be hard to pinpoint. And a lot of times in those situations, we'll just go ahead and start treatment right away without worrying about trying to get the patient out of the environment they're in. A lot of times, the treatment is itself enough to help the patient's immune system handle their environment, to grow and be able to handle the adversities of the mold exposure that they're seeing in their environment, and just starting treatment is the best thing to do right then. Now, just one important thing to understand about my experience with mold exposure in our clinic is the vast majority, I mean 99% of the time, we're seeing patients where we don't have a clear identification of what type of mold they're exposed to or what exact mold type is in their environment. Most of the time, when we're treating patients with mold exposure, we're doing it without a lot of the home testing that's out there and available. And I really emphasize this because, like I said, from an Eastern perspective, the specific type of mold that you're exposed to is less important than what your actual symptoms are and what your clinical signs are, meaning how's your pulse feel, what does your tongue look like, what am I seeing on the physical exam. Those are the main things that I'm looking for in my clinic when I'm determining a treatment strategy for mold exposure. And like I said, this is different from Western medicine. I also take care of patients in the Western perspective who are hospitalized. And when I see patients who are hospitalized, and in that setting, when I'm doing Western medicine, in select cases, I do fungal testing. And that's because in a Western medicine perspective, being able to identify a specific fungal organism, the specific fungal cause, it does make a big difference in what type of medication you use, especially when you're prescribing antifungal medications. Now, you have to keep in mind, those are different types of patients than what I'm seeing in the clinic. The patients that we're doing fungal testing on in the hospital are patients who are coming in because they are in respiratory failure. Their lungs are severely ill. They're on oxygen support. And the antifungal medicines that we're prescribing, they're also medications with side effects and a lot of risks associated with them. But oftentimes in the clinic, we're not in those emergency life-threatening types of situations. We're usually dealing with chronic symptoms. We're dealing with scenarios where our patients are trying to get back to getting their life back, having a functional lifestyle, being able to spend time with their family, do things, go back to work. Those are the kinds of things we're dealing with. And a lot of them have done testing and even tried Western medical treatments to oftentimes no avail. And that's why they're coming to us. Probably another talk that would be helpful for me is at some point in the future to have an infectious disease specialist, bring them on the show, talk about some of the fungal testing they do in their clinic, who benefits from it, and why they may or may not choose to do it. I would say from my experience, A lot of the patients who come to see us in our clinic, they've had various testing done before, they've had treatments done before, but because their symptoms have continued to persist, that's why they're coming to see us. So simply identifying a fungal reaction that your body may have and taking a Western style treatment for it, it doesn't necessarily give the resolution of the symptoms that you may be having. So that's really important to understand too. Testing, having a positive test is different from just having symptoms. So the last thing I want to talk about today is just to give an example about a patient who comes into our clinic and what their treatment for mold exposure looks like. And this is a fictional patient, but it's representative of our clinic. So our patient is Julie, and Julie suffers from mold exposure. We first met Julie back in the summer of 2023. She was 35 years old at the time. She had suffered from mold exposure for about 5 years before coming to see us. And she used to work in IT. She was a professional. She liked traveling. And about 5 years ago, she moved to a new home in the Houston area. And 3 to 4 months after moving into this new home, she just started noticing she felt more tired, more fatigued. She had trouble waking up in time to get to her job. She needed more sleep on the weekends. And she started noticing more cramping pain in the abdomen and in the pelvis. She had severe cramping pains that were associated with her periods. And sometimes it was just not associated with her periods as well, just in the middle of the month with no clear association. She had a lot of bloating. She felt cold. She used to jog regularly, exercise 3 times a week, but once she moved to this new home, she just started gradually giving up all of those things one after another. By the time Julie came to see us, she had seen some Western medicine doctors. She had her thyroid checked. She had blood work done. They recommended for her to do an endoscopy, but she wanted to hold off on it because she didn't really feel like it was going to help her. So that's when she came to see us. Again, it was the summer of 2023. And the first time I saw Julia, she was extremely tired. She was kind of pale. She spoke very softly. And we did a thorough exam. We examined her tongue, her pulse. We talked about all her symptoms. And on the first treatment, we just did a few needles, maybe 7 or 8 acupuncture points that we needled. And we prescribed an herbal tea. The herbal tea that we gave her was a modification of a classical Chinese medicine formula called Buzong Yi Qi Tang. And it was a tea that was especially designed to help strengthen the spleen, the stomach, the digestion, and improve the immunity system. And her body's response was good. She improved. She started building up her health. She was able to deal with the environmental pathogen she was exposed to. And the formula was especially designed to help lift the yang energy, or the positive energy of the body, the yang qi. And so we had Julia take a week of the tea, and then when she came back, she said she started feeling a little bit better in her energy. She was still having some bloating, but it came down from continuously every day to just 2 or 3 episodes per day. And so when we followed up, we saw her, we gave her continue the treatment and made some modifications to her herbal formula. And we saw her every 1 to 2 weeks for a few months' time. By about 3 months, she was doing much better. Her energy improved. She had color in her face. She was going out a little bit more, spending time with friends and family, and she was starting to do a lot of the activities she had before. She had some cramping pain associated with her cycles, and we just continued treating her for another 6 months, at which point most of her symptoms had completely resolved. And Julia was able to get back to work and continue her story. So Julia is representative of the typical patient we see for mold exposure and the type of treatment that they go through. Of course, every single patient is different, and our treatment prescriptions vary from patient to patient, but I just wanted to give you guys an illustration of what treatment for mold exposure might be like if you come and see us in our clinic. And because it's so individualized, that's why it's important to see a doctor who can give you personalized advice and individualized treatment plans. And that's what I do at Houston Acupuncture Primary Care. So if you have questions about mold exposure or you are interested in getting treatment, please see the show notes for how you can get connected with us. You can reach us through email, phone, or through our website at houstonacupuncture.com. Again, that's houstonacupuncture.com. And like I said, probably down the line, I'd like to bring somebody on the show who's specific to environmental testing for homes for mold. I know that's a big question that people always ask me in the clinic. And also maybe have an infectious disease specialist come on and talk about some of the testing and treatment that they do in the clinic for mold cases. But for now, I hope this was able to give you guys a little bit of insight into what we do in our clinic, and we'll see you next time.